So tonight we're having a conversation about brain fog, cognitive health, reclaiming your mental clarity with the use of functional medicine. So we're going to talk about all the things that can cause brain fog, and then we're going to give you a blueprint of what you can do at home and different tips and tricks and supplements and things like that that you can do to help augment your cognitive function, even if you're struggling with some other things that can cause it to be out of balance, like infection or nutrient depletion, things like that. So, the first step to brain healing is figuring out the root cause. Where is the brain fog coming from? Are we struggling with it being inflammation from infections or toxins? Is it inflammation that's coming from food sources that are contaminated or maybe are not organic and they just have too many chemicals on them? And then once we figure out the root cause, then we need to come up with a good solution. So that solution could be nutrition changes. It could be killing agents to get rid of the infections. It could be detox driven to get rid of the toxins. And then we use certain things like peptides and things called nootropics that help to augment the cognitive function. Now, some of the nootropics that you might be used to talking about or hearing about are things like Adderall, Vyvanse, Ritalin. Those are considered nootropics, but there are cleaner versions of nootropics that are more along the lines of amino acids that we can use that don't cause the same kind of side effects that we know of today with things like Adderall and Ritalin. And then we also want to look at more advanced tools or cutting edge functional medicine approaches at what as well. And that could be tech devices, that could be red light therapy, it could be stem cell and exosomes, things like that, that can also be used to really just biohack our way into reversing that inflammation in the brain. So tonight, my promise to you is that you're going to leave with specific actionable protocols that you can actually start right away. You don't have to wait, don't have to have anybody interfere to help you get your brain back in order. So the root cause of brain fog is really the culprit behind what's going on. We don't just age and have brain fog. We just don't get stressed out and have brain fog. Yes, those things happen when we're really stressed out and the cortisol level is getting really high and you're under that stress level for a longer period of time. Most certainly, that kind of stress level can cause inflammation of the brain, and can cause inflammation in other places of the body as well. But technically, it's more of the inflammatory things, the infections, and the toxins that cross the blood-brain barrier. And it really wasn't until about 10 years ago that we even thought infections, viruses, bacteria, toxins could even get into the blood-brain. We thought the blood-brain barrier was very pristine and very sealed off and wasn't nothing was going to cross that. And as people started to donate their brains to science for us to autopsy, when people had dementia and Alzheimer's and things like that, ALS, is when we started seeing a lot of these bugs in the brain. And so then we started realizing that maybe the blood-brain barrier is not as pristine and sealed off as it should be. And if these things are crossing into the blood-brain barrier, they're not just causing inflammation of the brain, but they're actually getting into the brain and causing problems. And so things that we know that do that are viruses, bacterial infections, tick-borne diseases, heavy metals, chemicals like glyphosate. You can get lead and mercury. Um, Certainly things like Roundup and some of the other pesticides and herbicides can also get into that blood-brain barrier. And if you already have a leaky blood-brain barrier, kind of like what we talk about with leaky gut, we know the connection and we'll call them both. If you have leaky gut, then you have leaky brain as well. If you have any of those infections, you may have them in the brain, which is causing the inflammation in the brain. We know parasites can get across the blood-brain barrier as well. There's some question. I don't know that there's actually proven science that bacteria that's in the gut can get into the brain, but it would make sense that it could. That barrier is very consistent. And the bacteria that live in the gut are also bacteria that can cause systemic inflammation and cause systemic bacterial overloads. And so some of those things like strep and staph definitely can get into the brain, and they live in the gut as well. So that's where some of that brain fog can come from as well when you're just primarily dealing with gut issues and it's not a systemic infection. So when we have inflammation of the brain, what's actually happening there is it's kind of like when your finger gets swollen and red and it becomes painful. You can actually see that inflammation. But if I told you the same thing was happening in your brain right now, you can't see that. So it's a little harder for us to understand exactly what's happening and what's causing the brain fog. And in conventional medicine, we're completely missing the boat on what's actually happening there. So, what's happening when you have this brain fog inside your brain is that you have these cells, sorry, called microglia. And think of them as your brain's security guards. When they detect a threat, like a toxin, like a glyphosate or a Roundup or an infection or high cortisol levels, they activate these microglia cells and they start pumping out all of this inflammatory chemicals. Um, Dr. Krasian is one of the world's leading functional experts on this, and he calls this neuroinflammation. And at its root cause of the brain function that no one's talking about. And there's three things that happen when your brain gets inflamed. First, the microglia go haywire and they start attacking the brain tissue. And second, like we had talked about a little bit earlier, your blood-brain barrier, that protective fence that's around the brain, becomes leaky. And then all these holes get inside that guardrail, so to speak, kind of like what happens with the gut as well. And then those pathogens and those toxins can cross the blood-brain barrier. And thirdly, the brain stops making something called BDNF, brain-derived neurotrophic factor. And this is kind of like your fertilizer in the brain. Without it, the neurons can't grow and they can't repair and they can't communicate properly. So all of these things start to happen to actually create the inflammation in the brain itself. So there are different triggers that can cause an inflammatory process. And this is where conventional medicine actually completely fails us because most of the time, your conventional doctor is going to run your basic labs, your CBC and your CMP, and they're going to say everything looks fine. We don't really know what's causing your brain fog. And unfortunately, most people get offered antidepressants at that point, especially if they complain of multiple symptoms, which we know brain inflammation does cause multiple symptoms. It causes, brain fog, word recall, sometimes slurring of the speech. Sometimes you'll have neurological conditions where you'll have numbness and tingling and tremoring and things like that. And it can get so severe that people can look like they have ALS or Parkinson's when the brain is extremely inflamed. So we know people who have a higher diet in sugar and processed foods causes your blood sugar to spike and then it typically crashes. And we call this a glycemic stress, but the brain literally goes into emergency mode, pumping out inflammatory chemicals. And when we consume those foods, it's like throwing gas on the fire. It just keeps getting more and more inflamed. And then certainly we have gluten and dairy, which don't just cause stomach issues. Research shows that gluten can trigger a zonulin release, and that's a protein that opens up your gut lining and opens the blood-brain barrier. So even healthy whole wheat bread can cause brain inflammation every single day if people are being exposed to it. We know dairy is a major issue because it creates it's proteins, casein and whey, and primarily casein actually acts like morphine in the brain. So that can cause a significant trigger of inflammation in the brain as well. Chronic stress, of course, pumps out a lot of cortisol levels. And when we have very high cortisol levels, it's like having more problems with gas on the fire, right? So a little bit of cortisol is good, too much is not. And when there's too much cortisol there, we can't turn off that inflammation. It just continues to be an issue. The unfortunate part is the body can't tell the difference between good stress and bad stress. So you may be planning a wedding or you're planning a funeral and the body can't tell the difference. Stress is stress. The body also can't tell the difference between emotional stress and physical stress. So if you're putting a lot of physical stress on your body and you're not leaving time for recovery, your body's still going to pump out a ton of cortisol, no differently if you were dealing with more emotional stress or daily work stress. So we want to definitely lower that cortisol level so the brain isn't on fire quite so much. Sleep is another issue. When we don't sleep, we all know when we don't have a good night's sleep, cognitively the next day, we're not doing as well. Part of that is because when we sleep, that's our removal process. The toxins are removed by what's called the glymphatic system. And it's like your brain's janitor. It's cleaning out that metabolic waste and those inflammatory proteins, but it only works when you're in deep sleep. So when people don't get enough deep REM sleep, your body's not able to remove those toxins. And so if we're in that light sleep stage for too much time, that's part of the reason you don't get to remove your toxins, and part of the reason why when you wake up, you don't really feel rested or repaired at all. And then we certainly have the leaky gut, leaky brain barrier, which I'm sure most of you are very well informed about. And this is where the gut lining is damaged, and those bacterial toxins called liposaccharides leak into the bloodstream. They cross the blood-brain barrier and they trigger massive neuroinflammation. And so your gut and brain are connected by the vagus nerve. So if you heal one, you can heal the other, and that's why it's so important to heal both of them at the same time. And then there are some red flags that we typically see, and we'll talk a little bit more about some of those red flags and what those culprits look like here. So we talked briefly about those stealth brain bacterias. So this is looking at chronic Lyme and co-infections. So Lyme disease, Bartonella, Babesia, Mycoplasma, anaplasmosis, Rocky Mountain spotted fever. These are some of your tick-borne infections and co-infections that can cause issues with brain fog. And then we have reacted viruses and viruses. So Epstein-Barr virus can cause brain fog when it's in acute phases, when it becomes a reactivated virus because of another virus. So like COVID or HHV6, any of those viruses that reactivate each other, those are going to cause new inflammation in the brain. And then there's certainly SIBO and other gut pathogens that also can cross that blood-brain barrier and cause inflammation of the brain and cause those same type of symptoms for you. So we talk about testing, and for those of you who know me, I'm not a huge fan of a lot of conventional testing. We certainly do conventional testing where it's accurate. But when it comes to infections, they're not very accurate. So if we did a PCR test for Lyme disease, oftentimes we're going to see an inaccurate result because those standard tests are only about 20% accurate. Viral testing by conventional medicine is much more accurate. We typically can see that. We'll see more of an old infection, so like an IgG versus an IgM, unless it's acute. On occasion, sometimes we'll pick that up. Spike protein testing, that's pretty accurate through Quest or LabCorp. But if we're doing testing for tick-borne diseases, we like to use companies like IGeneX or MDL. They're a lot more accurate. Some people like to use Vibrant Health. I'm not a huge Vibrant Health fan for tick-borne diseases. I don't see its accuracy there. It does pretty well for chemicals and metals. It does fairly well for viruses. It's just not my favorite for tick-borne diseases. Traditional testing certainly is really good at telling us what your immune system is doing. How well is your immune system functioning? It's not really great at looking at cytokines, which are your inflammatory markers. So when we're looking for inflammation in the body as a whole, and we want to see, do some of these infections actually trigger a cytokine storm, which all of you have probably heard us talk about over the last couple of years with the COVID, it creates that cytokine storm. A Quest or a LabCorp is not the most accurate to look for that. If we're lucky, we'll see 1 or 2 cytokine levels being elevated. If we do alternative testing, from Dr. Bruce Patterson's group, Radiance, we're going to see much more accuracy in that type of testing. So oftentimes we'll recommend non-conventional sources for particular tests, but where we can offer conventional sources like Quest or LabCorp, we will do that to try to keep the costs down for you guys wherever we can. So the toxicity in the brain, it's more like this environmental brain assault. We talked briefly about heavy metals. These are things like your mercury, your lead, your aluminum, your cadmium, which a lot of clients don't understand exactly where it's coming from. But as long as you breathe air, you're going to have exposure to these different chemicals and these different toxins. Our water is contaminated a lot of times in certain areas more than others, especially with glyphosates and phthalates and arsenic, especially if you're on a well, you're going to have a much higher time of water being contaminated that way. Even though we have unleaded gas, we're still breathing lead. Everything that comes in from China that has a painted source on it is going to be a lead contaminated place. We get a lot of aluminum from our vaccines, especially the virus ones. They use aluminum to keep the viruses around longer. So that's where we can pick up a lot of aluminum. Of course, any aluminum cans that we're using, any cookware that has any coatings on them are going to have toxins on them. So it's very easy to pick up a lot of these heavy metals. Um, of course, mold, mycotoxins, aflatoxins, these are major things that cross the blood-brain barrier, especially gliotoxin. Gliotoxin's known for getting into the brain, causing problems with the pituitary, disrupting hormones. So that's a pretty prevalent place for us to see brain inflammation coming from. And then I think one of the things we don't talk enough about is that EMF exposure. EMF exposure definitely disrupts the mitochondria, disrupts everything, makes all the viruses, the chemicals, the metals all more active and stronger. And we all know we're exposed to EMF. If we have a cell phone, we're getting exposed to EMF. Even if you use like a safe sleeve, you're still getting some EMF there. If you get a meter, you can test it and you can see how much EMF is coming off of your phone. We actually have one in the office. If anybody ever wants to use it, it's here. You can check your phones. We let people use it to take to their house to try to find EMF and hardwire things as much as you can. Try to turn your Bluetooth off whenever you're not using it. Your Wi-Fi off at night. That's really important to keep that EMF exposure down. There are some EMF exposure products that you can use. Some are good, some are not. It kind of depends. And then we could talk a little bit more about this when we talk about cleanup towards the end here. So nutrition is really key for us. When we're looking at a diet for brain health, we really need those healthy fats. So if somebody is on a low-fat diet, that is not the best diet for them if they're struggling with brain fog. Now, it's really hard because a lot of people with cardiovascular issues are put on a low-fat diet. And then we're restricting the fat to the brain as well. And we need healthy fats in the brain for our brains to function better. I am not a person who recommends low-fat foods. If you read the ingredients on there, they're mostly chemicals, they're pretty much toxins, and they're going to create a lot more inflammation in the body. So you want to do more ketogenic foods that fuel the brain. So things like avocado, you want to do, I'm not a huge fan of nuts and seeds. I used to always say do nuts and seeds, but nuts are so moldy. So you have to be really cautious, especially if you're somebody that's struggling with mold and you have brain issues. You want to be careful on your nut sources. Cashews are almost always moldy. Peanuts are always moldy. You're better off looking at nuts that are inside of a shell. That's a better source for you. Looking at any animal proteins, that's still a really good thing to do is the animal proteins. Blueberries, dark chocolate, green tea, those things are all really good. They're full of polyphenols, which are great for the brain. Your eggs are a awesome source of things. Who's ever drawing on the screen, can you just not draw on the screen because you're actually drawing on my slide deck? Um, Choline is amazing for the brain. We need lots of phosphatidylcholine, and eggs are a major source of that. 3 eggs is equal to 1 serving of phosphatidylcholine a day. So, phosphatidylcholine is super important for the brain to regenerate and to heal. Liver is a really good source as well to phosphatidylcholine. And ideally, if you can do a non-plant source phosphatidylcholine in supplement, it's really hard to find a non-plant-based source. Like if you can find an egg-based source of phosphatidylcholine in a supplement, it's much better than getting a plant-derived. But if all you can get is plant-derived, phosphatidylcholine is key for you. We talked a little bit about sugars and refined carbs already. You want to get rid of those inflammatory oils as well. So those vegetable oils, those trans fats that we used to say were so great for us, those vegetable oils, not so much anymore. You can cook with MCT oil. You can cook with uh, lard. That's actually a better source, actually. Butter you can cook with. Olive oil is great to cook with. Some people are cooking now with avocado oils. Those are all great. You just don't want to get them super hot. You want to, do a light sear with them, not do a boil with them. That's really good. I think also looking at your food sensitivities is really important. Unless you can tell exactly what you're eating is causing symptoms for you later, doing some food sensitivity is really important. If you're working with people that really need to be convinced that they shouldn't do gluten and they shouldn't do dairy, food sensitivity testing is helpful. If you can't even convince them with a delayed food sensitivity test, Cyrix Labs actually offers a test where we can do to see if those foods are causing reactions like an autoimmune reaction in the brain. And when you see that, that's usually enough for you to say, okay, I'm done. Because if it's creating this autoimmune reaction in my brain, I probably shouldn't be doing it. And some people need to actually see that is happening before they can give those foods up. Um, Making sure that we're healing the gut, we're putting plenty of serotonin in the gut. So that's things like turkey, almonds, avocados, another one that gives you some good serotonin. That's a really key player to helping you heal your gut. We don't talk about that healing the gut as much as we talk about it calming the body. But about 80 to 90% of the serotonin is made by the gut. And if you don't have enough serotonin in the gut, you don't have enough serotonin in the brain. And if you don't have enough serotonin in the brain, a couple of things are going to happen. A, you're not going to stay in that deep REM sleep. And B, your brain's not going to be able to function because without serotonin, our cognitive function is very diminished. And so you need that serotonin. And that's one of the other reasons it's so important for that gut lining to heal. And when we're talking about nutrients, there are some key nutrients that are really great. Omega 3s, your EPA, DHA, especially high EPA for depression. We also need very good EPA and DHA to actually grow the gray matter of the brain and to calm down the hypersensitivity of the white matter in the brain. So, people who already have white matter lesions, we need a lot of EPA, DHA to heal the brain and to grow that gray matter. We use things called plasmalogens, which I'll talk about in a little bit here, to help heal the brain when we see that kind of damage. But if we're talking about just cognitive issues and you're like, I'm just getting a little foggier, EPA, DHA, 2 to 3 grams a day can really be helpful for this. Also helps a lot with people who are suffering from depression. It can help lift that depressive feel. Magnesium glycinate is very good. That is the form that you want because that is the particular magnesium that crosses the blood-brain barrier. And you can use a lot of it, about 400 to 600 milligrams a day. It will not give you digestive issues like a mag citrate does. Mag citrate tends to go right through you, where mag glycinate is actually more utilizable. You want your methylated B complex, B12, folate, especially if you're suffering from an MTHFR mutation, because that doesn't allow you to detox properly. You can't make enough methylated B vitamins. You can't make enough folate from folic acid. So you really need to supplement with that methylated form. And then vitamin D, we give a pretty wide range here. 4,000 to 6,000 is typically what's needed for people in the north to maintain a blood level between 60 and 80, unless you have what's called a VDR mutation. And that's a genetic mutation on that vitamin D gene that doesn't allow you to absorb vitamin D from your food sources, and you may have a harder time absorbing vitamin D as a whole. In those cases, you want to have a dry form, not an oil-based form. So a form that has a powder inside the capsule instead of an oil inside the capsule, or a liquid version, because you're going to absorb that better. But sometimes even then, it's hard to keep that vitamin D level elevated enough, and people will need to do injectable vitamin D instead. That's kind of your tier one foundation. Your tier two foundation is going to be phosphatidylserine for membrane health. Phosphatidylserine is different than phosphatidylcholine. So phosphatidylserine also helps to lower cortisol levels, and it helps with good cognitive function. And then you want to do acetyl L-carnitine. This is mitochondrial fuel. So for people who are struggling with fatigue, brain fog, muscle recovery, recovery after activity, you really want to make sure you've got a good amount of acetyl L-carnitine in there to repair that mitochondria after it's been stressed. And this will help you build healthier cells. And when we have healthier cells, we're going to have healthier brain tissue as well. There's a lot of controversy about NAD. NAD is really good for the brain. It really helps with brain function. The downside to it is absorption. So as an oral capsule, it's much more difficult to absorb NAD. It's better as a sublingual tablet. It's also better as an injectable, and you can do an injectable once a week and get plenty of NAD. The key is not to get too much NAD, because if you get too much NAD in the body, then it gives you the opposite effect and it becomes more inflammatory in nature instead of more supportive in nature. And then curcumin with the piperine in it is really great for neuroinflammation. Curcumin as a whole, if we're using it for joint pain, you can use a different form of it. But for neuroinflammation, you want the piperine form. Always use pharmaceutical grade supplements. We call it nutraceutical grade. Make sure they're good quality, especially with cognitive function. If you're trying to repair that, you need to make sure it's a very clean source so it doesn't come from products that have been tainted or aren't being tested properly. Because if you're doing things that aren't being tested properly, you can end up with more neuroinflammation instead of less inflammation. We don't recommend buying on Amazon. It's not because we get a kickback. It's just that we've seen too many Amazon ripoffs. There are a lot of people that know how to make a label and make it look really good. At one point, about 6 years ago, we had somebody buy some Nutramedix liquid herbs from Amazon, and she was questioning them because they didn't smell the same, they didn't taste the same. And so she had it independently tested, and there was not a single ingredient in there that was in her Nutramedix vial. And so we know this kind of thing happens, unfortunately. So just be cautious. There is full script that you can buy from. Almost all of the companies that are nutraceutical grade are on full script that you can have drop shipped to your house just as easily as you can Amazon. So you have the flexibility there. So peptides, I love peptides. So peptides are new and up and coming, but they actually started in the world of functional medicine well over 10 years ago being used. And then the FDA swooped in a little bit, took them away from the compounding pharmacies, took them away from some other local associations, and kind of went away for a while, for a few years. And now they're reemerging again. And I think they're bigger than ever. There are a couple of different neurotrophic peptides that we can use that actually help to heal the blood-brain barrier, reduce inflammation, and give you that neurotrophic and nootrophic effect. So BPC 157 is probably the most commonly used peptide for healing the gut-brain barrier. BPC can be taken orally. It's great at healing the gut. Sometimes you need a good 6 months to 12 months on it to heal the gut, depending on how severely damaged the gut lining is. But it's also going to reduce the neuroinflammation. It will reduce inflammation everywhere else as well in the body, but not as efficiently as if we were doing an injection. So if somebody has a lot of inflammation everywhere, we may recommend doing it via injection versus if most of the inflammation is coming from the gut, then we're going to recommend using it as an oral capsule because we want to heal the gut, which can then ultimately heal everything else. Kind of depends on what you have going on there. Cerebral lysin is a really awesome neurotropic peptide. So it helps improve cognitive function. You do need to have clinical supervision with this. It is injectable, can be given IV as well, but primarily used as an injection. Can be used in people with dementia and Alzheimer's disease or just even early cognitive function. The thing with cerebral lysin is you need to cycle it. A lot of the peptides that we talk about need to be cycled on and off. And so there are different peptides that we can cycle on and off if somebody's using it for cognitive function as well. We can use things like CMAC and C-Lank, which I think I have on the next slide here. Let me see, and then I can go back. Nope, I guess I don't. So CMAX and C-Lank are also neurotropic peptides that help with cognitive function, with focus, concentration, and memory. And so we can cycle between those along with the cerebral lysin. Now, dihexa is also another peptide that you can use that actually grows the neurons of the brain. So if people have neuronal damage like Parkinson's, ALS, MS, dihexa is something that can be used. We can use it just to reconnect as well. So if we just want to use it short term, like maybe 4 to 6 weeks, and then take you off of it and use other things, we can certainly do that. It's a very potent peptide. It also helps with sleep, so it can be very helpful. There's something called Noopept, which also helps with focus and concentration. It has a lot of neuroprotection to it. So if somebody is struggling with focus and concentration because they have infection or they have toxins, Noopept is something that we can use to protect that brain as well. Whoops, sorry, I just went backwards instead of forwards. There we go. And then there are some nootropics that we can use. Lion's mane is actually a nootropic. And so this also helps to grow nerves. And it's a real mushroom extract. It's not a mycelium. So if you have mold issues, lion's mane is something that you can use. You're going to use about 1,000 milligrams a day. And then the racetams are peptides that we can use or nootropics too. Now, these are things that were used prior to identifying what Ritalin and Adderall are today. And so you can get something called piracetam, which I think is amazing for cognitive function. You can use a lot of it, about 1,200 milligrams 3 times a day. I actually used piracetam when I was studying for some of my board certification exams because I needed to remember a lot of data really quickly. And my brain was so incredibly sharp, I was able to spit things out like crazy and memorize them. And there are really no side effects to it. It's not a stimulant like Adderall or Ritalin, so you don't have to worry about taking it too late in the day. You can really take it anytime and it can really help. Oxiracetam is also helpful. It helps with that focus and concentration. And then you can also stack these things with choline and some of the other supplements, and you can stack them with the peptides as well, especially if you're, kind of cycling on and off different things. You can stack these, and we can help you develop a stack for yourself. Monofidil is also one that we'll use. It was originally used in people who had narcolepsy and had really extreme fatigue. And we still use it for those things, but we also use it for people with focus and concentration. It's so in my book. I think it can be helpful. In really bad fatigue, I think the peptides are much more helpful than monofidil, but monofidil is going to be covered by insurance and your peptides are not. It is considered a controlled substance, so you need to have some physician oversight for this one as well. And then some natural alternatives. Rhodiola is one of my favorites. Rhodiola and ginseng together are adaptogens. We use this a lot for our college kids that need to study and cram for classes and things like that. I will warn you with rhodiola and ginseng, though, you don't want to take this one after 3 o'clock in the afternoon because it does tend to keep you awake. So it's definitely something you want to use earlier in the day than later in the day. Bacopa is also another one that can be used for memory. It's not as strong, in my opinion, as rhodiola and ginseng are together, but it is helpful and it also helps reduce inflammation. And then there's just plain old ginkgo. That's probably my least favorite out of all of them. I think ginkgo can be helpful, but I don't think it's as good as, say, rhodiola and ginseng together mixed. So, when we're looking at what's going on with your brain, we want to know the story behind what's actually happening. So Dr. Goodenow has created something called the prodrome scan, where we can actually measure your plasmalogens. So plasmalogens have only been uncovered maybe about 5 to 10 years ago, just now starting to make some weight in the world of cognitive function. And plasmalogens can no longer be created from food sources and they're not produced by the liver. So as we age, we tend to lose these plasmalogens. And if we lose the plasmalogens too much, because of a mitochondrial dysfunction, because of an infection or some other toxin, our brain fog and our brain focus and concentration are really going to be depleted. And we're setting ourselves up for more neurological diseases such as ALS, Parkinson's, MS, Alzheimer's, dementia, those kinds of things. If we repair the plasmalogen level, we get the plasmalogen level back up to where it's supposed to be, then we can prevent a lot of those diseases. So in a prodrome scan, we're actually seeing those plasmalogen numbers. We're seeing the phosphatidylcholine numbers. We're seeing all the different mitochondrial dysfunctional markers, and we're seeing inflammatory markers. So we can see exactly what's happening with the brain and develop a plan to actually regrow the brain. And Dr. Goodenough's plasmalogen program has been going on a couple of years now. So we actually have multiple MRI scans that we can see how much brain regrowth we're actually getting by using the plasmalogens. And for some people, they're reversing their brain by 5, 10, 15 years in chronological age because we're regrowing that volume. So it's a pretty exciting time to be part of that. Certainly, whenever there's cognitive issues, we want to assess for whether or not there's been a mold exposure, heavy metals. We want to look at food sensitivities and even maybe some of that autoimmune response that's happening in the brain. And then looking at gut testing through a GI map or some other similar GI function test. And then also, it's not uncommon for us to recommend what's called a SPECT scan. So a SPECT scan is a very specific type of MRI that's done on the brain. It's done unstimulated and stimulated. So we do one at rest. We do one once we've stimulated your brain with a cognitive computer test, which most of you are going to be like, I'm already going to be stressed if I have to do that. But it's not so bad. And then they put some contrast in, and then they can actually see the different parts of the brain very differently than we see with traditional MRI. And so they can see things in the brain that identify OCD, depression, anxiety, ADHD. We can see holes in the brain from traumatic brain injury. We can see holes in the brain from infection. We can also see things um, that are different that we can't see on MRI. Like we can't necessarily see white matter brain in a SPECT, but we can see the other things that we normally wouldn't be able to measure. And so that gives us an opportunity to really dial in a unique experience for people to figure out exactly what's happening with their brains. So plasmalogens really matter because 20% of the brain is made up of phospholipids. It's a very critical membrane that's protected around the brain. And as it declines, that's where we see neurodegeneration. And so when I was diagnosed with MS back in 2022, my plasmalogen levels were in the toilet. And as we started to rebuild my plasmalogen levels, the white matter brain disease started to go away, and we actually started to see increased gray matter. So I regrew my brain by about two standard deviations. So that's about 5 to 7 years of age chronologically in less than an 8 month period of time. So you can really regrow your brain pretty quickly with plasmalogens. And it can be a very big difference. In some of our patients who have Alzheimer's disease or have dementia, our autistic kids are having amazing success regrowing their brains and regenerating that tissue through the use of plasmalogens. And so there's a couple of different types of plasmalogens that we use. There's prodrome glia, which is used for protecting the white matter. It's also very calming to the brain. So when we're using it in our autistic kids, we want to use glia first, calm the brain down, put the fire out. That's what we're thinking about with glia. And then when we want to wake up the brain and use it for good focus, concentration, memory, learning, then we give prodrome neuro. And oftentimes we want to use the glia for a couple of months before we use the neuro because the neuro can be rather excitatory. And so if we have a huge brain on fire, we don't want to go bringing more excitatory things to the brain until we calm it down first. So that's going to be your omega 3s, your DHA, your omega 9s, those kinds of things. So you don't have to take additional omegas if you're doing the prodrome products. And then we want to look at antioxidants. What can we do to protect that? For some people, it's grapefruit seed extract or grape seed extract. It might be vitamin C. There's lots of different antioxidants that we can do. And there's a test that we can actually measure to see what antioxidant is best for you. It's from a company called Cell Science. We can look at all your other nutrients as well, and it gives us that oxidative profile. And then certainly lifestyle, sleep, exercise, stress reduction. These are all really important things to bring in. And with doing this protocol, we can usually start to see changes within about 3 to 6 months. If it's a really severe case, it's going to take a little bit longer, but most of the time we're starting to already see some changes within 3 to 6 months. Some of the cutting edge brain therapies that we have available is hyperbaric oxygen. This increases your neuroplasticity, reduces inflammation. It is an off-label use. Usually hyperbaric oxygen is only covered for wound health. So if we're using it for cognitive function, it is a cash pay. We don't do it in our office, but there's several clinics around us that offer it that we can refer to if people are interested in that. And then, of course, neurofeedback is really great. It typically takes about 20 to 40 sessions for neurofeedback to actually start to work. It's going to work much better when you have that foundation of nutrition and food going. If you're just going to do neurofeedback and not do the other things, you're probably not going to see the benefit that you're looking for. One of the other neurofeedbacks that you can do is called prehag. We do that in our office. It really helps with trauma, anxiety, OCD, those kinds of things that are being the underlying cause for your brain fog and focus and concentration issues. Red light therapy is another thing that's really good. This helps stimulate the mitochondria. You can do this about 10 to 20 minutes a day. You can do it at home on the whole body. There are some red light therapies that focus on the head that you can wear as a helmet. Some of those are kind of gimmicky. They don't get all the way through to the brain. They can help with scalp treatment, hair loss, things like that. But in order to get one that crosses directly into the brain, you need more a clinical application for that. And then there's IV therapies. So we have NAD infusions that can really be helpful to clear out toxins, get the body moving again. Glutathione that also helps get the toxins out. High dose vitamin C gets the toxins out. There's ozone therapy that's really good for killing bacteria and viruses and rebuilding the mitochondria. Sometimes we'll use IV methylene blue or oral methylene blue. But there are lots of different IV cocktails that we can use that help to re-stimulate that brain and get rid of those toxins in the body as well. So here's your 30-day quick start protocol. And then I think I'm almost done because I know I'm going a little long. Sorry, guys. First and foremost, eliminate your inflammatory foods. So get rid of dairy, get rid of gluten, get rid of white refined sugar. If you could do those three things 80% of the time, you would be amazed at the significant difference that you actually see in your outcome of how you feel. You can start the omega 3s and the omega 9s, the prodrome neuro, the prodrome glia, start your magnesium, optimize sleep hygiene. If you need to use melatonin, melatonin is actually really good for the brain, really good for building mitochondria. So if you need some sleep help there, melatonin is really good. You can do immediate release if you can't get to sleep. You want to do sustained release if you can't stay asleep. And then you're going to do that foundation for about the first 2 weeks. The third to fourth week, you can add B complex, vitamin D, add some of the nootropics, add some of the peptides. Those kinds of things can be helpful. A lot of people start all of this without changing their diet, and that's totally fine. The only downside to it is you're going to still be producing a lot of inflammatory foods in your diet, which is going to increase the inflammation, which is then going to offset all of these things that you're doing. to try to reduce it. So diet is really huge. It's important for us to take that seriously. And then in month two, you can start doing some more advanced techniques, really doing targeted peptides and nootropics. So, like if we start a peptide in month two or at the end of month one, like a BPC or a TB500, something to really reduce inflammation, we're going to do that cycle for about 6 to 8 weeks, and then we can target different peptides that help with cognitive function. You don't always want to start with a cerebral lysin or a Cmax or a C-Link until you've reduced that inflammation first. And then same thing with nootropics. Unless you've been doing a lot of this before, I wouldn't just go right out and add nootropics. I would work on some of those other things first, then start adding your nootropics like your piracetam, your anacetam, and start using some of those to help reduce that inflammation. And it's all about consistency. Take small baby steps. You'll get massive results, but it's consistency that actually makes a huge difference for you. And then when should you look at getting some immediate help from a functional medicine practitioner? If there's sudden cognitive decline, you're waking up, you're slurring your speech, you can't remember certain things. That's really important. We have to rule out a stroke, things like that. If the memory loss is getting so bad that it's affecting your daily life, you really want to start taking that serious and doing something about it sooner than later. If there's depression with cognitive symptoms, you still want to address that. A lot of times we blow that off and we say, well, it's just the depression that's causing the cognitive symptoms. It may be, it may not be, but there are a lot of things you can do to help reverse that. When there's chronic fatigue and brain fog together, you got to evaluate cortisol levels, infection, things like that. If all of your labs are normal from your conventional doctor, but you still feel terrible, you got to seek out somebody who's going to dig for more answers for you. So I would say don't accept it's just stress or you're just getting older. Your brain deserves better. You deserve better. It's not just getting older. We don't have to get older the way we've been programmed to think. We can reverse a lot of that. So I don't have your brain fog recovery checklist in the resources yet to download, but I will have Megan get that to you. And then start a basic supplement protocol if you're not already on one. And then talk to your practitioner that you're working with to see if we can't tweak things a little bit for you so that your brain can follow the right roadmap and be as amazing as it possibly can and as amazing as all of you guys are.